Yes.
tell us your experience as a mother, as a patient, and I think also as an advocate for patients.
Yes, thank you. Hello, everyone. Thank you for having me. And I will share my screen just a second. So again, thank you for having me. My name is Eda Ömür, and I am from the Netherlands. I am a sickle cell patient, also type SS. And as you can see, I have a patient organization here in the Netherlands for patients named Voices of Sickle Cell. I also represent the Netherlands at the European Sickle Cell Federation. And I'm going to take you all with me through my pregnancy story. And I hope you can also learn some things that I experienced. So, first of all, my condition for having children was that my ex-partner would get himself fully tested if he had sickle cell anemia or something similar. This to prevent more sickle cell patients. I wouldn't wish sickle cell upon my worst enemy. So you can imagine, let alone my children. I considered it a well-considered decision to get your partner tested, if only to prevent other children having to suffer from this disease. So if you have a light form of the disease, it doesn't mean that your child has also got the light form of the disease. So my first trimester, my story began, of course, at a hospital bed in the ER. So I was having a lot of trouble with my knees and was yet again at the ER that night. After testing my blood, the doctor suddenly asked me if I wanted to know if I was pregnant or not. So my wish to be a normal woman remained. So my answer was no. As any regular woman, I simply wanted to pee on that stick to get to know if I was pregnant or not. I didn't want to lose that precious moment to a sickle cell patient's hospital life. I'm going to take you with my journey from sickle cell. I have divided it in 3 trimesters. My first trimester was week 1 to 50. My first trimester was a heavy one. As a sickle cell patient, I already had a lot of pain in my back because of the collapsed vertebra. The pregnancy did add only more pain to my back. Also, as a sickle cell patient, I was usually very tired. Now I wasn't allowed to do the blood exchanges anymore because of the pregnancy. So I was exhausted. So if you're pregnant, you are not allowed to get blood exchanges, like I said, but you are allowed to get transfusions. So there is a difference in exchanges and transfusions. So maybe the doctors can explain that later. The second trimester was from week 16 till 27. Doctors usually call the second trimester the best trimester of the pregnancy. It was my best trimester until I met week 27. Before week 27, I had a lot of pain in my calves. At the end of the day, I couldn't even stand on my feet and wasn't able to touch my calves because of the pain. So week 27 was a week to never forget. I once again was hospitalized because of my pain and of my hard belly. Now you have to know that the city I live in doesn't have an academic hospital. The only hospital that is specialized in sickle cell is the one in Amsterdam, a 1-hour drive from my city. I was nearly having a crisis, so the hospital decided, for the safety of the both of us, to get me to Amsterdam. I was carried away by ambulance, and at the ambulance my crisis started. Now you have to know that I wanted to have a normal pregnancy. I wanted to have a normal beginning for my kid, just like other kids. Because of that, I didn't even take an aspirin till that week. At the hospital, they took me to the recovery room to monitor me, whilst giving me morphine. I was crying both in pain as the morphine ran through my veins. Despite the crisis, they prepared me mentally that there was an option to have an emergency C-section. Although for me, it felt like they were going to butcher me and take my kid out of me. I finally pretended not to have pain anymore, just to stop them from giving me more and more morphine. I wanted to protect my kid from morphine. A discussion started between me and the doctor. From his point of view, I could receive morphine. According to him, it wasn't more harmful for the kid than the stress I experienced from the pain. But for me, it was, something else. So I finally made it to the third trimester. After week 27, I was looking at how much longer my body was able to carry the kid. Every day I became more and more difficult for my fragile body to carry the kid. Even though I've been able to carry him till week 36, we decided along with the doctor that at that point it was time to deliver the kid. I now had to decide in which hospital I wanted to deliver. Like you can see, I have shown you where I live at Deventer, at the Red Dot, and Amsterdam is a 1-hour drive. Deventer made great preparation and had a protocol that they discussed with me. From my experience, I can say it was a really good feeling to discuss the protocol together. I want to advise all the patients and the doctors here to go over a protocol together that you both feel comfortable with. Then you are both better prepared for what can be expected. Amsterdam didn't discuss a protocol with me. This is why I chose Deventer to do the delivery. The delivery. A sickle cell patient can't wait for the contractions. Any sickle cell patient has a planned delivery to prevent crises. On Monday, we started my contractions with an IV and they put a balloon inside of me. These contractions were awful. Looking at the experience of other women, it seems that IV contractions are the worst. After 2 days and 2 nights of contractions, I finally gave birth on Wednesday to my beautiful boy. And that was on January 31st, sorry. So this Monday is his birthday. And this is my experience with a pregnancy. Thank you all.